back problems.
Lower back problems. Tell me
Major.
Tell me about them.
I've gotten to episodes where I lift something or a wrong type of movement or something, it activates it where the pain is so unbearable where I can't move sometimes. It's just like a paralyzing pain, like it stiffens up.
Let's rewind a little bit. When did this all start?
When it started?
Yeah. When was your first episode or incident?
Like 6, 7 years ago.
Okay, so what happened 6, 7 years ago?
That's the thing, I don't know. I don't know whether I've did something. I've gotten car accidents, but I don't think that was the issue.
We'll get to that in a second. So let's rewind. So 6, 7 years ago, you were working when you noticed it. You woke up.
I woke up.
Okay, so you woke up and you felt what?
Sharp pain through my back.
Sharp pain through the center lower part of your back?
Yes.
Did it go down into your legs at all?
Yes, my legs. Yes.
Both legs?
Just my side.
The right side.
Yes.
Okay. And you don't recall anything the day before, a couple of days, any heavy lifting, bending, slips, falls?
Not that I could recall.
Okay.
Yeah.
And that was your first major incident 6 to 7 years ago?
Yes.
Got it. Okay. What did you do for it?
Took a lot of painkillers, of course.
Did it help?
It helped
at the time.
At the time. Eventually, it went away, so I just ignored it. I figured it was nothing.
The pain went away.
The pain went away.
Okay, so you got on with life.
I went on with life, and then I would say maybe a few months, half a year later, it happened again.
Same thing.
Same thing.
Same feeling.
Same
right
thing.
Leg.
Everything. Same thing.
Okay, you woke up.
This one was I carried something.
Okay.
I carried it. And
Carrying
I felt
what?
A box about 30 pounds.
Okay.
I felt. I don't want to say a rip, but I felt like something pulling.
Like a little tear almost?
Yeah, and it didn't happen, the pain didn't happen instantly. I just felt it, I'm like, okay, something wrong.
You felt it when you lifted the box or when you put the box down?
Also when I lifted the box.
Okay.
And then the pain didn't happen instantly until like the next day. Then the next day, that's when I really felt it. And it was for another good 2 weeks I was in pain.
Painkillers?
Painkillers, of course.
Okay. Better painkillers? Same ones.
Better painkillers.
I don't know that there's a better painkiller, by the way. I'm just saying, I was joking. It's more powerful.
More powerful, yes. So within the 6, 7 years, it'll come, it'll stop, it'll come. Then I got in a car accident.
Hold on. How many times a year are you getting these?
At least 3 or 4 times.
3 or 4 times a year.
A year.
More in the colder months, more in the warmer months, or it doesn't matter?
Yeah, it doesn't matter, I don't think.
Okay. Then you got into a car accident.
Got in a car accident. It didn't activate it. Then
car accident? What happened in the car accident?
Someone just sideswiped me on up behind.
Okay.
And then I went to the chiropractor. Then they took x-rays. This is when I found out my disc was kind of messed up.
In your low back?
My low back.
Okay.
And then right after the car accident, it activated it again. So I don't know whether it was because of the car accident or just common. You know what I mean? It was just a normal thing.
Okay.
That has been happening in the last 6, 7 years. Then it went again, painkillers again, it went away. The most recent one was probably like 4 months ago.
Okay.
I did a turn and I felt the same pull, and the next day again it happened. And when that happened, it lasts about like 2 weeks. The pain's there for like 2 weeks. It's bearable, walking less. I take painkillers. I can't barely lift anything. Getting up is really hard. I have to like go on my side, go on my knees and get up because I can't stand straight up.
Okay. So painkillers is really what's been getting you through right now.
Painkillers been getting me through.
How are the painkillers affecting other parts of your life though? Because you got to take a lot, I'm assuming.
I take it.
Or do you take a lot?
I don't take as much as I only take it if I'm in pain because I had problems with painkillers before all this.
What? Tell me about that.
I had addiction to it.
Okay.
And then I had to get help.
Okay.
And then I got help, and then it worked, and I had to go through withdrawals and everything. But the pain was so unbearable where I had to take painkillers.
So it's kind of defeating
the
purpose. So if we can help stop you needing those painkillers,
yes, that's the whole
it's a good thing.
That's
right?
a perfect thing.
And I think forget it for the pain, but more in terms of what else is it doing if we're getting some sort of addiction to it, right?
Yes.
Okay. All right. Your last episode was 3 to 4 months ago.
Yes.
Okay. Same spot, same issue, same everything.
Yes.
Okay. All right, so is there anything else I need to know?
There's sometimes numbness on my hand, on my arm.
Right arm, left arm?
Right.
Okay.
When I wake up in the morning, I feel the numbness sometimes.
Okay.
But it doesn't bothers me as much, but I just go on with the day.
Okay.
I'm very cautious of what I do now, of like lifting anything, getting out of the car. I'm very cautious because I'm scared.
And is that normal? That's not normal.
That's not normal at all.
That's not normal because you're getting the same issue recurring.
Yes.
Now, have you seen other doctors or anyone for this?
I just finished physical therapy.
For how long?
Like 2 months.
Who prescribed it?
The doctor, yeah.
Okay, what was found? What was the issue?
They said it's degenerative disc disease.
Okay, so you were diagnosed with degenerative disc disease
yes.
of what? L4, L5, L5,
I don't
S1?
I don't remember.
Low back.
Low back, yeah.
Okay, and that's the reason you have this pain.
Yes.
And physical therapy, you go do this for 2 months and it's going to fix your pain?
No, I didn't.
No, but is that the intention?
Yeah, that's what's the intention, to
So
help it. Yeah.
It will help it.
Yeah.
Okay. What was changed after 2 months of physical therapy? Twice a week, 3 times a week?
3 times a week.
Okay. And did they told you it was? They didn't tell you the disc. They just said you have degenerative disc in your back.
Yeah.
And go do physical therapy.
Yeah.
Okay. And that's a common thing now, guys. Okay. I need to share a little information now. You know, this is a very common case, a very common condition. I'm not discrediting or discounting what you're going through, but it's very common of what we see, not just in my office, but in many offices around the country. In your situation, we're going to go over your x-rays and your exam, right? And I'm going to show you kind of where this came from. This didn't start 6-7 years ago. This actually started over 15 years ago, maybe 20. And maybe you'll remember as we go through the process and the journey, okay? So whatever happened 6 or 7 years ago triggered something that was already there. And I'm going to explain it on your x-rays, okay? So your number one complaint of being here is your low back.
Yes.
You've had it several years.
Yes.
Yep. And the painkillers aren't working, or they are, and we don't
just throwing it under the rug, that's all it's doing.
Got it, okay. All right. Anything else I need to know about you? How's your sleep?
Sleep is good.
Sleep is good?
Sleep is fine.
Okay. Digestion?
Digestion
More
is...
regular movements every day?
Every day. Every movements every day. There's no really... Sometimes there is, but I don't know if maybe it's not because it's like I'm constipated. Maybe that's about it.
Is your diet consistent? Your food?
Yeah, I'm trying to eat more healthier ever since everything's going on. I'm trying to eat more healthier.
Okay. All right.
Yeah.
Okay. So what's our goal?
I don't know. Just to get better.
Let's get better.
That's
okay.
it. Whatever it is, just
let's get better.
The road to getting better.
Sounds good. So the first answer then on the road to getting better is we need to find out what the problem is and what is the obstacle that's not allowing you to do so.
Okay.
Fair enough?
Fair enough.
Okay. Let's stand up, sir. I'm going to have you walk. Okay. And the first thing we want to do is we want to watch him walk. And what I want to see is the dimples. He's got some pretty cool art here. That looks like a... Who's that?
It's the Monkey King.
And who's that? The Queen?
No, it's just his other face, and it's undone. It's not finished yet, so there's a lot more stuff to do.
All right. Let's walk it out.
So
let's walk.
Straight
line. Walk back and forth several times, please. Just how you would normally walk. Yep. And the first thing I want you to notice in his walk is as he's walking, both his feet externally rotate out. Keep walking. You're going to come to right about here. Turn, walk to the end, and you can see that wiggle in his hips, right? He wiggles to the side, to the right side, and he tilts down on that right side. Keep going. Do you swing your arms when you walk, or is this your walk? Walk normal, dude. Just walk how you normally walk.
Yeah.
This is your normal walk.
Yeah.
Okay, I want you to see the sign that says nervous system over there?
Yeah.
I want you to just focus on that sign and go touch it. Don't think about your walk. Just go touch it. Cool. Come over here, please, and just high five me over here. Turn around, go and touch the nervous system chart again. So the reason I'm doing this is so he's not thinking too much about how he's walking, he's just performing the action. Got it. As he's walking, he swings that left arm. You keep going. He swings that left. He actually swings both of them. And he's got the wiggle, right? You coming from where? San Diego?
Yes.
Yeah, so he got the San Diego wiggle going on there. We have 24 bones in the spine, 23 discs in between. So I want you to think of this as a 24-story building.
Okay.
And the foundation of the building is the pelvis and the sacrum, okay? Now, in this work is all based on the level foundation principle, which states what? If we want a stable building, we need a stable foundation. And that's the first thing we need to look at. We're looking at the foundation. We have good stuff. We have a couple of things that are off, but not so bad. When we're looking at the pelvis, and I'll tell you what these numbers all mean, okay? When we look at the pelvis sits on a slight angle, right? Mm-hmm. When it misaligns back, the vertical distance will be larger. When it misaligns forward, the vertical distance will be smaller. In your case, 230 and 231, there's not a lot of difference between up and down from either side. The issue is going to be in the rotation. So what it's showing us is this, that the pelvis is rotated slightly to the right side. Mm-hmm. It's doing this. The sacrum is rotated on the right also, so follow the process. The right pelvis goes in, the sacrum goes back with it. But which way is your spine going? So there's a disconnect in your low back. Now, when we get to this x-ray, and we look at the shape of this disc, this is L5, L5, this is L4. L4 is worn out pretty good. L4 should look like L3. That shape of that disc tells me 15 to 20 years ago. That wasn't 6-7 years ago, okay? Now, that's L4. L5 is gonna be about 7 to 10 years. So 2 separate things happening here. But before we even get to that and address it, I circled down here. And this, when we're looking at the sacrum, this should be a smooth arc. When I see this nub here, I know there was an old tailbone injury. There was an old tailbone fall. And I can see it right here as well. And right here. So the first thing we need to do in your situation is we need to stabilize your foundation. Pelvis goes one way, spine's going the other. So what are the muscles trying to do? What are the ligaments trying to do? They're trying to hold it. And one wrong move, like you were saying, is activating it. Yeah. Does that make sense?
Yeah, it does.
Okay, let's continue. The level base right here, the sacrum, okay? First one to go off is L5, slightly on that left side. L4 compensates. L3 goes with it, 2 goes with it, 1 is still going with it, 12 is going, 11, all the way to 8. Now, if I run this base here to 8, you see how they're level? So between 8 and sacrum, all of this is compensating for this. I can find things that are going to hurt in here, but it's not the cause. Important. Why I'm showing you this is these curves that are going on here, they're all a function of the low back, okay? T8 is our next level. The next one to go off is 7, yeah? Goes with it 5, 4, 3, 2, 1 comes back to level. So what is that telling us here? 7 is a potential, 5 is a potential, and we have the tailbone, okay? Does it make sense what I'm going over?
Yeah.
We have an issue in the low back, that's what brought you in. We will address that, but this is a consequence of all this.
Yeah.
Now I want to talk about this x-ray and we'll get into this whole disc and your pain now, okay? But this is important to get an overall understanding of our body mechanics. On this x-ray, we are designed to have 60-degree reciprocating curves. 60, 60, 60, okay? That is our first line of defense against the forces of gravity. 60, 60, 60. That's our shock absorbing mechanism. Yeah. For whatever reason we lose that curve, that's when things start to wear out unevenly. In the low back, let's look at it. First thing is we don't have as much curve as we want. We want to have a little more curve in here. I'm going to explain 5 and 4 in a second. So we want to have a little more curve here. We need a little more curve in the mid-back. And then what's happening in the neck?
Straight.
Straight, starting to reverse. This was your old whiplash injury. C5. C6, though, is probably where it's starting, or even C7. So the idea is, if we don't help you get these curves back, or you don't work on getting these curves, what's happening? The body starts to compensate, muscles and ligaments start to go a little bit off balance and work harder as they've been doing for you. Okay? Now, let's go deeper into this. So, we said there was an old tailbone injury here, starting here. That's probably where we would start. Okay? Probably. The only other place that we may start is your pelvis, because we have rotation. Yeah? If we're down in the nub here, S3, we would be on the right side to help the rotation part. Okay? This IN ilium, or the rotation here, is what's causing the straightening here. So we sort out this to get your curve back here. Okay? Let's go up. C5, C6 potential on this x-ray. We have sacrum, L4 or L5. Now, L4 is worn out here, but on here we see L4 is not the cause, right? It looks worn, it's worn out. Yeah. But the reason it's worn out is because it's been compensating to down here. So it's actually probably been hypermobile, moving, and that's probably whatever has happened over the years. When you get that, something happened, let's say your lifestyle, work, whatever it is, and then one day we slept wrong, we woke up wrong, we twisted, whatever it is, and because of that hypermobility, the body spasmed. Make sense?
Yeah.
Okay. Any questions on the x-ray?
No, really.
Okay. Shall we get started?
Sure.
Have a seat. Now this is a mini thermography unit. It's basically a temperature meter. And what we're doing when I'm running the meter on your back, we're looking to see at every level of the spine, it should be even from side to side. If there's irritation or inflammation there, it's going to register on the meter. Okay? Starting at the base of the neck. First thing we're getting, 10, 11 points, C6. Top of the neck is clear. Yep. C6, 12 points. T7, 5 points. All right. You said you wanted me to do my job, right?
Yes.
Cool. And now, he's had this for a while, okay? I'm gonna run the meter several times to kind of wash out the nerve. So what's happening is, it was going left first. And as I run it several times, it's gonna start to go right. There it is. And there it is. And you said it was going down your right leg or your left leg?
Right.
Yeah. It's low, S3, S4. S3, S4, T7, T6, C6. 1, 2, those are your 3 majors I find on here. Next, let's check the motion of the pelvis. Scoot forward, please. A little more. Feet together, feet touching. Open and close your knees. Make sure your feet are touching. Open your knees, close your knees. Open wide, please. Open and close. Right side only. Keep going. Open and close. Now, what's happening here is this, it's not the joint moving, it's all that tissue. Left side only. When he does the left, the right is actually moving with it. It's a little misleading here. Okay? So when he's doing this, my right thumb is actually moving. When he does the right side, it's all this tissue that's pulling. It ain't moving here. So we have a right potential SI joint issue. Sit back for me, please.
Oh yeah, there's one more thing I forgot to tell you.
Of course. What's that one thing?
When they're doing my exam for you know, I don't know, there's like a machine that you use to like hit the knee or something.
Yeah, reflex.
It wasn't a reflex, it was like see if I had feeling on it.
Yeah.
This side I felt it, this side, when they were doing it, I felt nothing. So I don't know if that means anything.
Well, that does mean, who did that exam?
The doctor.
Okay. Yeah, that's kind of important.
Yeah, I forgot what it was.
Making me do medical stuff now. I'm just. And tell me, you should feel that, right?
Mm-hmm.
Okay. Does this feel like this?
Do it again.
Does this feel like this?
Not really.
What's different?
It's lighter.
Lighter on which side?
Right.
It's lighter here?
Yeah.
Okay. Does this feel like this?
I feel more on the left than the right. Right, I feel it, but it's not as intense, I guess you could say.
Okay. How about here? Does this feel like this?
No, not really.
Still feels less?
Yeah.
Okay. Does this feel like this?
Yeah.
Does this feel like this?
Yeah.
Belly button. Does this feel like this?
Yeah.
Does this feel like this?
Yes.
Okay. Does this feel like this?
Yes.
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 Okay. Does this feel like this?
Yeah, kind of.
What's different?
This one's a little bit more intense than this one.
So right about the knee is where you start to get less feeling.
Yes.
Is that correct?
Yes.
Okay. Open your eyes, please. Close your eyes. Does this feel like this?
This is more intense on the right.
More on the right?
Yeah.
Does this feel like this?
This more on the right.
Does this feel like this?
Yeah.
What? Feels the same?
Yeah, it feels the same.
Okay. So the arch feels a little bit different, but sacrum feels the same. This is around L3, L4. Does this feel like this?
No.
This is less or more?
Less.
Okay, so you have less sensation here, but more up here.
Yes.
Okay, so that's a good test for us then after. Okay, less sensation here, more sensation here. Let's go continue. That was important. Good information. Anything else you need to tell me?
No, the whole time thinking like this whole time like there's something that I remembered.
Okay. C6. Now let's check the mid. Head down, please. Static palpation. Right when you get to there, you get the swelling and edema here. More tender there or there? Both hurt? That one?
Yeah.
How about below?
No,
Starts here.
yeah.
Okay, head down, please. 1, 2, 3, 4, 5, 6, 7. T7. Check the sacrum now. 4. L5. Starts to get tight. S1. S2. S3. That's the one. S3. S3, T7, C6. Does it make sense what I found in your low back, sir?
Yes.
You understand what my
Yes.
thought process?
Yes.
Now it should be a little bit easier for us. Let's get started. We're ready?
Okay.
I'm going to start with the neck.
Okay.
Yep. From the neck, we're going to go to the low back and then the neck. C6, PLS. We're going to start it off nice and light. Nice and light. We got to get right under to lift that C6 over. That's it. A little bit more. C6, PLS. Left ear down, down, down. There's the rest. Gotcha. You okay there?
Yep.
Cool. Let's go over here, face down, please. S3. 1, 2, 3. S3. S3 is something we're finding a lot. You know, we're getting so many people coming in being told they have an L4, L5, even an L5, S1. and they got treatment for it and nothing helped, and we found an S3. Look up, please. There you go. Relax the shoulders down, okay? You're good. Home run, sir. Gotcha. Relax the shoulders, down, down. Good. Let's do T7. There you go. Okay, let's walk. And as you're walking, you'll tell me if anything is different. It doesn't matter good or bad.
I feel more weight on the right side.
A little more balance?
Yeah.
Keep walking, please. Keep walking. Have a seat over here. Let's rescope you and continue. C6 is clear. T7 is clear. Scoot forward, please. 7 is clear. Sacrum is clear. Now I want you to feel the difference, okay? 5. 1.
Wow.
2. That's the 3, dude.
Wow.
Different?
Oh yeah.
No pain, right? Wow, Chiropractic. Good. Ears. Shoulders. Give it to me. Down, down. There. There you go. Squeeze my hand. Squeeze. Squeeze. A little bit here on the elbow. Straighten the elbow. Gotcha. Straighten it up. Good. Squeeze. Relax. Lunate. Scaphoid. Squeeze. Squeeze. Questions?
One coming. When's the next time I get home?
You feel different now, right?
Yeah.
Okay. Now, just as a test, can you sit on the floor, please?
Anywhere.
However you'd like to sit. Okay. Now stand up. It should be easier for you on your back.
Oh yeah. Way easier. Awesome.
Welcome to the office.
Thank you.
Welcome back.
What's up, YouTube?
You had to throw that in. Welcome back.
Yeah.
So we had one visit yesterday.
Yeah.
We worked on 3 spots, and tell me kind of what happened from yesterday till today. What's different?
Normally getting out of the car is a little not difficult, but I feel it. I'd be more hesitant, but getting out of the car.
More stiff getting out of the car?
Yeah, I'm more hesitant to get in the car because I don't want to make a wrong move.
Okay.
So I can say that I'm more confident getting out of the car since yesterday.
Very nice.
It's a confidence thing now.
Okay.
As for getting out of the bed, I still feel it,
Yep.
but I don't know whether I was being hesitant because I wasn't sure. Because every time I get out of the bed, I'm like always hesitant.
It's a story you've been playing every morning that you get up.
Yeah, every morning. So now, hopefully, all goal is getting out of the bed, just normally just moving because I'm scared that movement where it's just that one wrong movement will activate it again.
I got
That's
it.
what I'm really scared of.
Okay, so we need to break that habit and that story.
Yes.
Yes. I want to test the sensation because that was kind of important.
Okay.
Okay. Let's test out the legs. So go ahead and close your eyes, and you're going to tell me if left feels like right or if there's more sensation on one side versus the other. So first, let's test up here. Does this feel like this?
Yes.
Does this feel like this?
Yes.
Okay. Does this feel like this?
Yes.
Does this feel like this?
Yes.
Does this feel like this?
No, that one's a little less than that one, yeah.
Okay. Does this feel like this?
Yes.
Okay, so this was different yesterday. These are even now?
Yes.
Okay. This and this.
No, not really.
Same?
It's not the same. This one's more intense than this one.
Okay, so we still have diminished sensation in the right calf, but the arch sensation is the same.
Yes.
Okay, how about out here? Does this feel like this?
Yes.
Okay. Does this feel like this?
Yes.
Does this feel like this?
Yes.
So it's really just here on the medial side of the calf. Back of the calf is good. Tibialis anterior, peronei, all of this is good. Yes?
Yes.
Okay. So it's a good test for us. Now, let's go ahead and check the spine. Let's see what we find. So starting at the base of the neck, we've got about a 5-pointer today at C6. 6 points. Top of the neck is good. Mid back is good. And we're going to continue down on S3. We have a 5-pointer. You did pretty good, dude, with one adjustment. I got 5 points down low. I got 5 points here today. Mid back is clear. Scoot forward, please. Let's check the movement in the pelvis. Make sure everything is good. Feet together. Open and close the knees, please. Open and close. Left side only. Right side only. Yeah, they're both a little fixated from the sacrum on S3 still. Sit back for me, please. All right. Now, as we said, remember, once we get that S3 cleared up, we're going to need to move to that L5, okay? 1, 2, 3, 4, 5, 6, 7. That's what we did yesterday. Good. Head down, please. So this story is pretty interesting. What's going to happen with him is as he's getting stabilized, you're going to see his confidence level is going to increase tremendously. And this is kind of what happens to us, you know. We get into this routine of pain, and what ends up happening as you've experienced, you wake up, we're in that story. If I move wrong, what's going to happen, right? Even if there's no pain there.
Yeah.
So each day I want you to get up and say, I'm better than I was the day before.
Okay.
Fair enough?
Yeah.
Okay, let's do it. C6. Feet out, resting on the heels. Good. Nice and easy there. C6. Now we just want to get right under C6. We got to lift it up. Get it over the disc. Good. Look up. Gotcha. Let's do a tiny bit more on that right side. Tiny bit. Drop the chin down. He's a little resistant. Look up. There's the rest. Gotcha. Come on up, sir. S3. It's funny, we talk about having monkeys on our backs. This guy got monkeys on his backs. Nice and easy. S3. I need you to bring that chin up, sir. Good. As I apply pressure, I need you to let it go down with me. Good. You're doing fantastic. Good. You gotta let it go down, brother. Good. Beautiful. Good. And that's the home run. Gotcha. Different.
Yeah.
Good. Go ahead and sit on the floor, please. Okay, stand up. Have a seat right here. C6 is clear. The monkey on the back. Chiropractic helps take the monkey off your back. All clear there, sir. Check it out. All the way back. L5. S1. It's like the Matrix today. S2. This is the one from yesterday.
Oh yeah.
No twinging today, right?
Oh.
How about at S2?
Oh.
No twinging at all?
Nothing.
How about S1?
Oh.
Seriously?
Good.
Beautiful. Let's tune up the rest of you now, sir. Ears, shoulders, let me do the work. There you go. That's it. Okay, stand up for me, please. No, we're good on the nose. Squeeze my hand. Squeeze. A little bit on the elbow. Squeeze. A little bit on the elbow. Lunate. Gotcha. Squeeze. Day 2.
We're
Doing good. Questions?
And go next time.
I'll see you in a couple of days.